In an isolated hollow in Murray County, Bernie Ellis is recovering from his most recent hip replacement. For now, tending his expansive garden is difficult.
I feel like I'm at my spiritual center when I'm in the garden.
For more than 20 years, Ellis has lived with degenerative joint disease and fibromyalgia. It helps explain why his love of gardening developed into a new pursuit:
the cannabis I was producing.
Growing medical marijuana on his property.
Being able to get a good night's sleep, cannabis really helped with that.
Ellis used marijuana to relieve his symptoms for years and eventually supplied AIDS and cancer patients with the drug. Then came the day in 2002 when he was working on his farm and looked to the sky.
I saw a helicopter flying very low.
State and federal agents raided his property, seized his plants, and Ellis pled guilty. Suddenly, the respected public health epidemiologist couldn't find a job. Now Ellis has a new public health passion: making marijuana a legal medicine.
It certainly has quite a potential to help a number of sick and dying people, and we should make it available. 18
states in the District of Columbia now allow medical marijuana. 2 states, Washington and Colorado, have approved recreational use of the drug. While the South has resisted legalization, last November a referendum to permit medical marijuana in Arkansas failed by just 2 percentage points. Here in Tennessee, the issue has been debated on Capitol Hill for years and even passed a House subcommittee in 2012.
I don't know why we would want people to suffer.
Representative Sherry Jones supports legalization. She believes marijuana relieves pain and helps people with diseases like cancer, multiple sclerosis, and glaucoma. For Jones, the issue is also personal.
My brother died 2 years ago after about 8 months in the hospital with Crohn's disease, and he wished that he had been able to have medical marijuana.
Any change in the law would include restrictions and oversight, but many believe in the end it's bad public policy.
Introducing a drug that is so overused and abused by so many people, I just don't think that's a good idea.
Senator Joey Hensley is also a board-certified physician. He has a number of concerns and says not enough research has been done on medical cannabis.
Doctors don't know how to prescribe it. You don't know how much to prescribe for what illness.
This year, with Republicans in firm control on Capitol Hill, the issue may be dead on arrival. What's the chances of medical marijuana passing right now?
Well, I think 2 chances, slim and none.
Bernie Ellis now takes 9 medications for his diseases. Before the raid, he only used marijuana.
I really think this is could be and should be the most politics-free issue that the legislature faces this year.
For Ellis, it's about compassion, believing the plant he used to grow, the plant that changed his life, offers so much potential.
The time is definitely now to move forward.